Hi everybody, welcome to my channel. I'm Susan and this is Susan's Life with ALS. Today I'm going to talk about the ALS Clinic. Once you get diagnosed with ALS, you want to try to find a clinic that is certified in your area. Now that's kind of hard for some people, I know. The clinic that we go to, I say we, it's either my daughter that goes with me or my husband, is about 25 miles away. Relatively easy to get to for us. We did ask the MA, I think he was, how many patients they have in their ALS clinic, and he said 150. Some people come from Alaska. So that makes me think that some places don't have certified ALS clinics. And what a certified, I'm going to look at my notes here. So the one I go to is called an ALS Certified Center of Excellence. And what that means is it is multidisciplinary, family friendly, and they are great communicators and cater to the patient and not, or the person, and not just the diagnosis. And they focus their care on the person. So you go to an ALS clinic, at least in my experience, you go every 3 months. And I was diagnosed November 27th of 2018. And so I went 3 months after that, and then I'm on my second time. It was 3 months from my first time. So this time I had a better idea of what was going to happen. So I'll kind of go through my experience at the ALS clinic, and maybe this will help somebody else who's newly diagnosed, going through the same thing, and what you do when you go to an ALS clinic. Okay, so it starts with getting a schedule. So I'll just kind of put this up, and I was mailed this, and then in the future our medical assistant said he would send it to me in a PDF file, via email, which is easier for everybody. So my day started once we got there at 10:45, and that was check-in, and you do that on a different floor, at least in my ALS clinic, from where the clinic is. So you check in there, and then once you get up to the ALS clinic itself, they'll call you back, and then that's the room that you're going to stay in the whole day. And then the multidisciplinary part comes up, and that's who they are the PT, OT, pulmonologist, doctor, nutritionist, who else did I see? Social worker, a registered nurse, and I do get my vitals taken. So you get called back, and the first thing they will do is vital signs, which are they'll take your weight, then blood pressure, pulse. They didn't do an oxygen saturation or respirations, so it wasn't a complete assessment by the MA, but that's okay because then as the day progresses, somebody is checking my pulmonary function, which is lung function. So I say because my husband was there with me, then the next person that came in the room we were going to be in for the whole day was the respiratory therapist. So what she did was a what's called PFTs, and I'm a registered nurse, so I know what that stands for, but I would just like to explain that part, what the letters mean. Pulmonary function test, which measures what your lungs are doing. So she had me take a deep breath, and then she would put this mask measuring thing on my face and tell me to blow out as much as I could, engaging my diaphragm, which is the muscles under your lungs, and as much as I could. Okay, we did a couple of those tests. Then it was going to be the other way, where you're blowing out as much as you could blow out. And there was a machine, a small machine that, you know, in a mask she put over my face. Then, let's see, it was as cough as hard as I could. And that didn't have a machine, she just watched me do that. So that was her. Then the next person that came in, and this was within minutes of the respiratory therapist, that's how fast the day goes, was the registered nurse. And she wanted, basically her function is to talk to me to make sure I'm doing okay on the medications that I'm on for ALS, make sure everything is kind of being covered that I would need to talk about with the doctor. And she kind of is the eyes and ears a little bit of the doctor who spends, you know, 5 minutes with you, and I'll get to that. Okay, then after her, a social worker came in, and an ALS association representative came in with her. And the social worker listened to me. She's not a counselor, but more of a person that gives you ideas for managing stress, such as mindfulness, meditation, what I even call distraction, things that make you feel good, and try to do a little bit of that as you can every day. And she also reiterated to me many times that I could call her and she would talk me through things, the mindfulness or the meditation, or, you know, whatever. And what I want to say at this point, everybody at the ALS Clinic, because I think it's, well, they're good people, but I think it's how they got to be an ALS certified center of excellence, because they are so engaged in every patient, and you can call them anytime, and it really makes a difference. Find a good ALS clinic that is certified. All right, so after that, tag team practically. No time to potty or eat, and that probably would be my one complaint of the ALS clinic, but I digress. So the next person that came in was a pulmonology doctor, and he looked at my results of my first provider that I saw after my MA, the respiratory therapist, and saw what her results are, and he just kind of chatted with me and said, "You really don't need me, and I will see you sometime down the line when you do need me." So that was great. What that kind of said to me in my mind was, maybe my next ALS clinic will be a little bit shorter in time, because this took basically all day. Okay, so next tag team, the person that saw me was the speech and language pathologist, and she just had me go through some, I guess they're neurological tests. I'm a registered nurse, so I kind of know what she's doing, but it's been a long time since I've worked in a hospital. And anyway, so she had me do things like cat, 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 and different things that I would have to use different muscles in my mouth and different kind of neurological regions to make things happen. Past that, okay. So then the next person I saw was a nutritionist, and she does follow my weight and my eating habits and make sure that I can let's see, no, the other person, the speech and language, made me eat awful slimy peaches and drink water and test my swallow and that kind of stuff. So the nutritionist just wanted to make sure I was eating enough, maintaining my weight, and she knew I was still swallowing fine. So that was our talk. So then after that, I did see the neurologist, which is my doctor, and she did do a neurological exam on me, and covered my, looked over my medication list and any concerns I had. And she addressed those very nicely and competently. After that, I saw the rehab doctor, occupational therapy, and physical therapy. And for this appointment, I did bring all my equipment, the cane I like, the brace I like, and the walker that I like. And so they looked at all those things, asked about my falls, gave me some good advice. All of them were very nice to listen to me. I saw the doctor the neurologist before I saw them, and so I kind of wanted to talk about a little bit what the neurologist told me, and that was fine with them. So then what would have been after that is a wheelchair specialist, but I'm not. I'm still ambulatory, which is still walking in basic or independently, but with a device like a cane or a walker, but I can still walk. So I don't need the wheelchair specialist. So we didn't see him. So then after that, the first person came back, who the medical assistant, to give us our appointment for our next ALS clinic, which would be 3 months, basically 3 months from now, and that will be September 25th, and I will give an update then. So that's my experience at an ALS clinic. I do recommend that you go to a certified center of excellence for ALS, and you will get the best treatment, even if you have to fly there. And I know that would be hard on some people, but it makes a difference in your ALS. I hate to use the word journey, but your ALS life. I'm coming to rely on them, and I think I'm supposed to. So anyway, that's my 2 cents on my experience at the ALS clinic. Thanks for watching, everybody. Bye-bye.